Jess. Good afternoon. I'm Dr. Ahmet Gudeloglu from Turkey. I'm a urologist. I'm going to present an evidence-based medical perspective for robotic microsurgery. Basically, I will give you a brief summary of what are ideal recommendations and how do we apply those recommendations to robotic microsurgery. These are the objectives of my presentation. After this speech, you will be able to describe the differences between surgical innovation and drug development, and then you can explain the deficits of current surgical innovation methods, and then you can identify ideal recommendations, and hopefully in the future you will implement those recommendations for your robotic microsurgical procedures. This is the definition for surgical innovation. It's basically a novel or modified surgical procedure that differs from current standard treatment of care. When we look at drug development, there is very well-structured process, very well-structured framework. It starts from phase 0, which is preclinical trials, and goes through phase 4 after post-marketing interventional studies. But when we look at the surgical innovation, there is no mandatory minimum level of evidence such as in drug development. The studies basically relies on observational and cohort studies, and this results persistent difficulties in high-quality evidence for surgical innovations. There is a lack for structured framework for surgical innovation, and this causes difficulty in defining surgical procedures precisely, and it also causes iterative modifications. Even your first human procedures are unsuccessful. The lack of structured framework for surgical innovations also causes lack of agreed standard outcomes in surgery, operator learning curves, and procedure quality. So in 2009, the Balliol Colloquium created ideal recommendations, which starts with the idea stage and follows development, exploration, assessment, and long-term stages. Our group actually ideally suited for the application of ideal recommendations. Why? Because we do numerous novel microsurgical procedures that represents a broad field of early stage of surgical innovation. So we'll walk through very quickly for all stages. Stage 1 starts with the idea. This is the first human study, and in that stage you can report your first cases, even they are unsuccessful. That's very important. When you present it, it's important to give a detailed technical description. And just to mention, it's better if you use visual movies or pictures for your innovation stage when you register it. And I'm not agree with it because when you do a study first in human, and if you achieve success, you will publish it. That's why you need an IRB before doing any kind of novel technique in your practice. It's an ethical obligation obtain informed consent actually, but even if you are not successful with that very early report, very first cases, it's important to register your report because this prevents other unsuccessful repeats. So I think for this stage, you need an IRB approval. I know how difficult it is, but you need it. And it is followed by the development stage. That stage, you describe your technical modification, technical detail, and you can discuss your indications, short-term outcomes, and safety of your novel procedure. And then it is followed by the exploration stage. In that stage, you can publish your larger number of patients report. So the studies in that stage usually prospective collaborative studies, and those studies discusses procedural quality, and learning curves. Outcomes of those studies can be compared with the standard treatment of care, but those are not randomized controlled trial, and those outcomes calls for randomized controlled trial. Those trials are actually in stage 3, which is assessment stage. That stage basically compares your intervention, your novel intervention with the standard treatment, and by using high-quality randomized controlled trials or other valid experimental comparison methods. And finally, ideal recommendation recommends you long-term studies. By using long-term studies, you can identify rare or late outcomes. You may analyze risk or other prognostic factors, and you may change sometimes your indication. In study designs in that stage are usually long-term cohort studies or retrospective case series of large administrative data sets. The first meeting of ideal collaboration was in Oxford last year. I presented two studies relevant to robotic microsurgery. This one, we basically did a literature search, systematically assessed the design of studies on robotic microsurgery. We have identified 35 unique clinical research, and they can be classified as stage 1, stage 2A, and stage 2B as 16, 5, and 13 numbers. But interestingly, none of them made a reference to ideal recommendations, and there was no study addressing ideal 3, which are randomized controlled trial, and ideal stage 4, which is the long-term study. And so with that study, we can say the uptake of ideal appears limited among robotic microsurgeons. And the second study I presented last year in Oxford, you may remember 2 years ago we sent an online survey, and I presented the results of that survey. The majority of the respondents, they had no idea about what are ideal recommendations. And what is interesting, 43% of our members performed first in men robotic microsurgical procedure, and more than half of them indicated that they did not get IRB approval. So the barrier, according to RAMSES members, when they implement ideal recommendations for robotic microsurgical procedures are resource utilization, financial and time utilization, and concerns about delaying patient care and getting difficulties IRB approval. So in summary, IDEAL provides very well-structured framework for evidence-based assessment of our robotic microsurgical procedures. We should definitely apply IDEAL recommendations. We should make a reference when we report our outcomes. And this promotes best possible research and highest quality patient care for our robotic microsurgical cases. Thank you for your attention.